Hello everyone, welcome to sqadia.com. Today we're going to talk about the nutritional support in a patient. Now imagine with me you're a hotshot surgeon, you've performed a very nice, very complicated procedure. Now you have to manage your patient nutritionally. Or in another scenario, you are a very nice surgeon and a high profile patient comes to you, and you have to initially manage the patient nutritionally so that the patient can be ready for an elective procedure. So how would you do that? This is what we are going to deal with in this section. The nutritional support has been divided into 5 sections. In the first section, we'll talk about the stimulants, which are stresses to the body, which act as stresses to the body and add to the stress on the body itself. These will include the hypovolemia and end-organ hypoperfusion. Then we'll talk about the tissue damage, pain, and determinants of host response to the stress. And finally, we'll talk about body composition, nutritional status, age, and gender. We'll see the norm in these, then we'll see the abnormal, and we'll talk about how to improve and how to correct the deficiencies which are there in the patient. Then in the second section, we'll talk about the elective surgery procedures and critical care. We'll talk about the nutritional support in elective surgery. We'll talk about the nutritional support in critical care. Then we'll talk about the methods which are used to determine the daily energy requirement of patients in critical care. In the third section, we'll be talking about the access routes for nutrition. These would include the enteral or parenteral nutrition. We'll deal with the complications of total parenteral nutrition, and then we'll also talk about the composition of an ideal formula of total parenteral nutrition. In the fourth section, we'll be talking about the nutritional considerations of a patient. We'll talk about the enteral nutritional considerations. We'll see what these are. Then we'll see the macro and the micronutrient selection. We'll see what is important and what's not, and then finally we'll talk about various access routes other than the normal. In the final section, we'll talk about additional considerations while giving nutrition to the patient. These would include the infectious process and fever. We'll see the effect of those on a patient with deranged nutrition. We'll talk about organ failure and bariatric surgery along with the nutritional deficiencies and nutritional anomalies in a patient. Then we'll deal with specific populace, that is the geriatric patients, patients with diseases, and patients with other complications having nutritional deficiencies as well. So it's a very important lecture that would help you manage your patients in whatever field of medicine you are. I hope you're excited about today's lecture. For further such lectures, keep watching sqadia.com.